We move on to Sinn Féin. Deputy Pearse Doherty has three minutes.
Taoiseach, over the past few weeks we've borne witness to the scale of absolute crisis in the health service under your watch and Minister Simon Harris's. Our nurses and midwives were forced to take to the streets, something that never should have happened if the Minister had listened to their concerns in relation to the recruitment and retention crisis and taken those concerns on board. We've had GPs protesting outside the gates of Leinster House. Hospitalists continue to grow to enormous levels, and the trolley crisis is a crisis that we are now seeing day in, day out, and not just during the winter period. And the debacle surrounding the National Children's Hospital rumbles on is going to have a serious effect in relation to capital projects in both health and in other areas. And we will have an opportunity later today, thankfully, to quiz the Minister in relation to his handling of this, because there are very serious issues and questions that still need to be answered. And despite the acquiescence of Fianna Fáil, an apology that was offered yesterday isn't going to cut it, is not good enough, and we in Sinn Féin are very, very clear that this Minister is out of his depth and that he is not up to the job. But the issue I want to raise to you today, Taoiseach, is yet another example of why I believe Minister Harris needs to go from the Department of Health. This morning, as has been mentioned, it emerged that nearly 80,000 smear tests are waiting up to 27 weeks for the result. And this happens as a result of a ministerial decision taken last year to allow free screening made available in the wake of the cervical check controversy. Women, we know, are now waiting up to 6 months for the results, and it is undoubtable, unfortunately, that some of those results will indicate cancerous cells. And it's an appalling situation, Taoiseach, and one that is of utmost concern to women right across this state. It's yet another example of the complete incompetence and the chaotic system that we see in the Department of Health and the ministerial oversight of that. The Minister announced free screening without any consultation with the labs, without carrying out any analysis of the capacity, whether there was an ability to do what he intended to be carried out, and going ahead without ensuring the labs had the means to carry out these tests, and the increased workload guaranteed a major crisis and major problems that we now see emerging. It's been suggested on media on RTE earlier this week that the former Director General of the HSE wasn't made aware of the political decision that was made by Minister Harris. But he also suggested that he indicated that that decision should be walked back because there would be unintended consequences. Unfortunately, we see very clearly what those unintended consequences are. Unfortunately, we know that there are 78,000 women who are waiting up to 27 weeks for their results. The Minister didn't have the consultation with the labs. The Minister made a political decision which has directly now impacted on the length of time that is taking. Is this not another clear example of how the Minister is out of his depth? And the Minister, during that period, again pledged to us, and I'm finishing this, the Minister pledged to us again during that period that the HPV vaccine would be test would be rolled out. He said it would be autumn, then he said it would be January. Now we hear from the committee that they can't even tell us whether it will be rolled out in 2019. Minister, should the Minister have taken on board the advice of the Director General of the HSE? Should he have consulted with the labs to avoid the crisis that we're in today? And is it not now really time to face up to the facts that the Minister has to go?
Yeah, it's curious to hear Sinn Féin now quoting Tony O'Brien, the former Director General of the HSE, as part of an attack on the current Minister for Health. Your last motion of no confidence, if I remember correctly, was in the former Director General of the HSE, Tony O'Brien, who you thought a few months ago was unfit for office. But now you're using his words as an attempt to pursue the next head. It shows the entire approach of Sinn Féin to the health service, which really doesn't care about patients, doesn't care about the health service whatsoever. It's just a stick to beat the government with. It's just a constant, ongoing political attack. Health is a very difficult area to manage, a very difficult area to lead in for any minister and for any government. But it is an area where, despite the many difficulties we have, real progress is being made. We see that in the fact that life expectancy has increased in the last couple of years. We see that in falling mortality rates from cancer, improving survival rates on stroke, improving survival rates on heart attack, much better clinical outcomes across the board. And these things don't happen by accident. They happen because of the hard work and professionalism of our healthcare staff. They happen because the government is pursuing the right policies and strategies by and large, and because of the additional resources that we're putting into the health service all the time. Even in some of the most difficult areas, like people waiting for operations and procedures, up until last month anyway, at least up until the strike, we were at a 4 or 5 year low in terms of patients waiting more than 12 weeks for operations. There'll be a setback now for the next few months as a consequence of the strike, but we'll get on top of that again. And this year so far, we're seeing the number of patients, and still too many, I accept that, but this year so far, we're seeing the number of patients spending time on hospital trolleys at a 3 year low, if not a 4 year low. But the other thing I would just turn your attention to, Deputy, is the situation in Northern Ireland. Northern Ireland is an area in which your party was in government for over 10 years. The last health minister up until 2 years ago was your party leader in the north, Michelle O'Neill. And many of the same problems are faced in Northern Ireland. Overcrowding in hospitals, unacceptable waiting times, overruns on budgets, and a reform plan, the Bengoa plan, which has not been implemented. And I think I just see a very good editorial the other day in the Irish News. The health service needs a minister. Why does the health service in Northern Ireland not have a minister? The health service in Northern Ireland, does not have a minister because the Sinn Féin health minister resigned over a heating initiative. So, having denied Northern Ireland a health minister, now Sinn Féin wants to take away ours. We're not going to let that happen.
Deputy Doherty, 1 minute. Deputy Doherty.
Corlia, and let me be very clear to you, Taoiseach. The women at the heart of this latest scandal are our wives, our sisters, our mothers in Sinn Féin. So don't lecture me in terms of my concern for people that we love. Okay? This is a direct result of a political decision that was carried out without any analysis by the Minister for Health. Now, I question, because the Minister for Health has said that he had full support in relation to the decision that he carried out. Now, what we have is the Director General telling us that he informed to walk back from this decision, that there would be unintended consequences. But regardless of this, what is known as a fact is that there was no analysis carried out in terms of the capacity. What is known as a fact is that there was no consultation with the Director General of the HSE. What is known as a fact is that the Minister did not consult with the labs in relation to the capacity. You say that you acted with your heart instead of your head. That is cold comfort. Cold comfort to the women who are waiting 27 weeks to find out if there is abnormalities in the smears. Now, you talk about accountability, and we are looking for accountability. This minister is completely out of his depth. And it's not just on the cervical cancer scandal, it's not just on the Children's Hospital scandal. Week after week, people that we know, people that we love, people who have cancer are having operations cancelled because of the dysfunctionality in the Department of Health and the HSE and the lack of oversight and hands-off approach by this minister. So can I ask you, Taoiseach, are you aware of any consultation or any capacity analysis carried out by the Minister for Health before he made that decision, which has resulted in today 78,000 women having to wait up to 27 weeks to find out if they have cancer's abnormalities in relation to their smear test? That's the issue, and stop trying to divert attention from it.
Deputy, that is the issue, and I acknowledge the anxiety and the concern and the worry on the part of tens of thousands of women who are waiting on a result from their smear test. When the programme was working efficiently, people would get a result in 4 to 6 weeks. Now it's taking 4 to 6 months, and I acknowledge that that is a big problem, and we're doing all that we can, working with the HSE and Cervical Check, to reduce the backlog and get back to a turnaround time of 4 to 6 weeks, and that will be done. The situation has arisen, as I pointed out, because of a big increase in the number of women attending for smears, both because of the free test and as well as a general increase in those attending, which has continued into this year. But the solution to this problem is not a political attack on anyone, and it's not removing our health minister. Removing our health minister will not mean that the Children's Hospital gets built any quicker or any cheaper, and certainly won't mean that the backlog and the wait time for women waiting and worrying about smear tests will get any shorter. It'll be just the same. It'll just be the same as Northern Ireland. Walking away from your responsibilities, not taking accountability, leaving the control of a health service in civil servants. So having removed yourselves from responsibility in Northern Ireland, having removed yourselves from the Department of Health in Northern Ireland, where you could have done things right and shown us how things should be done, you now want to remove the health service here in Ireland.
Deputy Brendan Howland, 3 minutes.